Hi, this is Dr. Brian Raskin, and this is my first of many video series that we're going to be emailing and putting on YouTube for you. Today's topic is going to be your recall appointments and why it's important to come in on your regular 3 or 6 or 4 month recare appointments and take care of your dental needs. I'm sure most of you know who I am, and I'm going to be talking mostly to those of you who don't come in routinely for your recare. I have a lot of patients that make and schedule their 3 month, 4 month, 6 month recare appointments, and the ones that do come in I find need much less work and much less dentistry than the patients that wait a while in order to then come in when they have a problem. The most important or the biggest complaint I hear about why I shouldn't come in is nothing hurts. Why should I come in? Nothing hurts, nothing bothers me. And I understand that concern, and I understand that we don't want to give that expense if we don't have to, but dentistry doesn't always hurt, and by the time actually it does hurt, it's too late. Most pain in dentistry means that there's a major problem going on, whether it's periodontal disease, whether it's an abscess or an infection, or whether a tooth finally needs root canal. Those are the things that happen when you're in pain. When you're not in pain, you still can have problems. You still can have periodontal disease, bone loss, you can have infections and not know it, and you can definitely have cavities that develop between the teeth. It's our job during your recare appointment to find these problems before they get bad and serious, before they end up causing problems like tooth loss. Because once you lose teeth, obviously, it's not so easy to put them back. So our goal is to create a situation where your mouth is healthy, where there are small problems that we can fix easily, and that you'll go for a lifetime with great smiles and a mouthful of your own teeth, not somebody else's, meaning implants or dentures. So let's go over some of the purposes of a recall. What do we do during that visit, and why is it important to come in? First of all, we do an oral cancer screening. We can do a regular visual screening, which we do with every patient, and we can do a more advanced screening using a special light system that finds out whether there's changes in your cells and changes within the gum tissue that looks precancerous or cancerous. These oral cancer screenings are very important to catch problems very early. If we catch them early, they're much easier to treat. If we wait for these problems to get very bad, now we have an issue. I've had a few patients over the years who've developed oral cancer, and they've gone through many different types of treatment in order to take care of these problems, and it's not something I would wish on anybody. The other things that we do is we take x-rays often during these visits. Not always. There are times where we might skip a visit and not take films. But what are we using x-rays for? We're trying to find small cavities, or maybe large ones, that you can't feel that develop between the teeth. My goal when we take x-rays, obviously, is to find nothing. We don't want cavities. But often we do find things that we cannot see clinically. We can't see because they're between the teeth. And if we do catch them, we can possibly do a filling or an onlay or a crown before you need to do root canal, or even worse, extract the tooth. So just be aware that when you say I don't want any x-rays, the benefit of our x-rays outweighs the disadvantage of them. We do all digital x-rays, the radiation is very little, and if we catch a problem before you end up losing a tooth, it's well worth it. The other issue during your recare is periodontal disease, gum disease. And gum disease is something that causes tooth loss in many adults. It's signified by red puffy gums, bleeding gums, and it causes bone loss. The thing about gum disease is it doesn't hurt. There's no pain associated with it unless it's in the last stage, and you often get periodontal infections. With gum disease, we often do probing and measure bone loss. We look for inflammation, and we might tell you that you need more than just a cleaning. We do scaling and root planing. Sometimes we use our laser to treat the gums and do laser curettage, and sometimes we even need to do gum surgery. But coming in routinely, my patients who do come in routinely, and I see every 3, 4, or 6 months, often need less gum treatments, less expensive work, because they are maintaining their dental health. Just remember, we do these recare appointments in order to catch problems before they get bad. And most dental problems don't hurt until they're a problem, and we don't want them to hurt, and we want to make sure our goal is that you keep your teeth and you smile forever. Some patients complain about bad breath, and these can be caused from dental problems, from cavities, and also from periodontal disease. So if you experience any of these issues, maybe it is time to come in. Bad breath can also be part of a digestive issue, and it can be something that's not related to your mouth, and these are the things that we're going to look for. If you don't have any dental problems, sometimes the problem is coming from your digestion and from your stomach. Also remember that heart disease is related to gum disease. Patients who do have plaque builds up underneath their gums and in their mouth can also have plaque buildup in their arteries and around the hearts, and it's been proven that there is a correlation between these plaque buildups and the susceptibility to heart problems and heart disease is there. So come in more routinely, less chance of having heart disease if we obviously get rid of your gum disease and periodontal disease. One other thing I want to discuss is if there's any patients out there who are diabetics, these patients should be coming in more routinely than a patient who isn't. If you're diabetic, and especially if your A1C is very high, you are much more susceptible to periodontal disease, to tooth loss, you don't heal well, and we should be seeing you more often than somebody who is not a diabetic. The other person that should be coming in more routinely is somebody who has a lot of dental work in their mouth. Anybody who has a lot of crowns in their mouth, veneers, a lot of reconstruction or implants, these patients need to come in on a much more routine basis for maintenance. When you have this type of dental work, you have more ability to get plaque buildup, tartar buildup, and it needs to be removed on a more routine basis. Plus the margins around all these crowns and all this dental work needs to be checked, often with x-rays and physically, visually, so that we don't let the problems develop and get worse. So that should give you an overview of why it's important to come in for your recare appointments. Again, we were talking about 3, 4, and 6 months, and we cater our recare depending upon what your patient's need is. If somebody's got perfect teeth, doesn't get cavities, doesn't have periodontal disease, then every 6 months is really adequate. And we say every 6 months because I don't want a problem to develop for a whole year before I see it. If the day you leave my office you're starting to get a cavity, I don't see you for a year later, it could be a big problem. If I see you 6 months later, we can probably take care of it. The patients who I see every 3 or 4 months are the ones who are more susceptible to gum disease. And also there are patients that just get a lot of cavities. On those patients, we want to see you a little more routinely to catch things earlier and to make sure that you don't end up needing any major work. So again, this is my first of a number of video series that we'll be doing on a somewhat routine basis. And I'm just trying to keep you informed about what's going on in my practice, what's going on in dentistry, and give you a good handle of how important it is to us to take care of your dental health and keep your smiles for a lifetime. Well, thanks again, and we'll see you next time. Again, this is Dr. Brian Raskin. Take care.